Which of the following is most likely cause of this patient's symptoms? All right. Seems like a poem question. 21-year-old tall, thin man presents to the ED with a sudden onset of sharp left-sided chest pain and shortness of breath. He has no significant past medical history, denies any recent trauma. On physical exam, his blood pressure is 120 over 80, pulse is 100, and respiratory rate is 22. Decreased breath sounds are noted on the left side and no tracheal deviation. Chest x-ray reveals a left-sided pneumothorax with lung collapse. Okay. Which of the following is most likely cause this patient's symptoms? Okay, let's see. So remember going over pneumothorax, there's two main types. The tension pneumothorax, I'm pretty sure, has the same sided tracheal deviation, and the other one has the, or maybe it's that one has tension is opposite. Spontaneous, I think, is same sided tracheal deviation. This one says there's no tracheal deviation, although let's see. Um, Spontaneous tension. Tension's usually from like trauma, if I remember that correctly.
Okay.
He's tall, thin man, shortness of breath. Vital signs are okay. And they're saying lung collapse. Hmm. Primary spontaneous. I'm just trying to think. I went over this last night too. I reread that section real quick. Hmm. The tracheal deviation thing usually should help you with the type of pneumothorax, but they're saying there's none. Um, I don't see too much evidence for like a PE with like DVT or any recent trauma or surgery. I don't see anything for rib fracture. There's no pain or
Mhm.
discomfort. Um, Pleural effusion. I'm having a hard time. I think that's the thing where they show like the air fluid level in the
Okay.
lungs. I don't see anything with that. And like I said before, I think tension is trauma and spontaneous is not. So I would go spontaneous.
Yeah, you worked at that great. So let's talk about this together. Okay.
Okay.
So right off the bat, when they give you, 21-year-old tall, thin
I'm
man,
thinking Marfan, like, right? That was my first thought was,
yeah, you can for but just Marfan's is definitely a risk factor for
or
this because
Marfanoid, like body habitus, they say.
yeah. Yeah, so anytime they talk about a primary spontaneous pneumothorax, it's usually in a male that is tall and skinny. Okay.
Okay.
That's kind of one of the risk factors. Also, on top of that, you mentioned some good things about tracheal deviation. Remember, tracheal deviation only happens with when the disease process is really really big, like bad, right? So
Okay.
if you have a spontaneous pneumothorax that you don't fix for a while and it keeps getting bigger, then it's going to suck the lung, suck the trachea to that side, right? Same side,
Yeah.
right? Tension, I always remember it's, you build up all this pressure, usually from trauma, like a fractured rib that pokes into the lung, right?
Hmm.
And it builds up that pressure to shove the trachea to the contralateral side, right? To push it to
Okay.
the other side. So yeah, for sure, right? Rib fracture and tension pneumothorax, right? I mean, they're kind of related. They can't both be the answer.
Okay.
Pleural effusion, like you said, right? There's a lot of things that can cause pleural effusion. I mean, infections can cause it, right? Congestive heart disease, right? Cancers, like lung cancers, can cause it. But 21-year-old, no prior medical history of anything, unlikely to be pleural effusion.
And that is the thing with air fluid level, right? Like it was,
Yeah, I mean, more like, if you were to kind of, if I were to draw, you know, um, the lungs here, what will happening is you'll have whiteout, right? You'll have
okay.
whiteout of the kind of your uh diaphragmatic costal angles, right? So you wouldn't see
Okay.
kind of the sharp edges here.
Okay.
But yeah, for sure. And then let me see, clear all drawings. And then, yeah, pulmonary embolism, right? No risk factors of, sitting on a plane for a long time. He's not
Right.
hypercoagulable, anything like that. So unlikely.